Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 and City News Briefing for Wednesday, February 10th. We will start with today's hospitalizations. Between Merit Health Wesley and Forest General, there are 72 people in the hospital with COVID. That's 5 under where we were over the last 14 days, and of those 72, 26 are in the ICU. As you can see, we continue to see a real decline in those hospitalizations. We've hovered under 80 for a little over a week now, and we hope as the vaccine continues to get out into the vulnerable populations, that number will go down even further. Statewide today, there were 784 new cases reported with 25 new deaths. Unfortunately, since our last briefing on Friday, there have been 6 deaths in our metro area, 2 in Forest County, 4 in Lamar County, bringing the totals. We've crossed the 200 mark, 134 in Forest County, 71 in Lamar County, and we send our heartfelt condolences and sympathies to those families involved. New positive cases today, Forest County saw 24 new cases, Lamar County saw 33, and since this began, Forest County has seen 6,746 total infections and 5,520 in Lamar County. Our 5-day average continues on the whole to drop. Both counties are now under 30. Now that we're kind of under where we were in the July spike, we anticipate that number is going to keep going down if we're all continuing to do the things we know work. That the 14-day inside 14-day number. This is the number of people who have received their positive test result in the last 2 weeks. Forest County, that number is now at 422. In Lamar County, that number is now at 365. Big accomplishment for us. This is the first time since early November that we've been under 800 potential active cases in our community. And as you can see, if you look back to the left of this graph, you'll see at the peak in late July, early August, we were over 800. So we're finally under where that peak was back during the summer months. Compared to a week ago, Forest County went from 504 to 422 inside 14 days. Lamar County 431 to 365. So in 1 week, we brought that inside 14-day number down by almost 150. Hospitalizations around the same, 70 to 72 this week. ICU down 29 to 26. Our goals continue to be protecting the vulnerable, people over the age of 60, people with underlying or chronic health conditions. Second goal is preventing overrun of the healthcare system by slowing the spread so that we can prioritize public health while keeping the private sector open. We prevent the overrun of the healthcare system that goes to hospital capacity. And I know this morning we had several dozen acute beds available. However, we're full in the ICU front. Of course, that changes throughout the day. People tend to discharge in the morning and take in the afternoon. So we'll continue monitoring that going forward. 5 factors that we use to accomplish our goals. This used to be 4, but we've now added a 5th now that we have the vaccination. Widespread availability of testing, wearing masks, watching our own data, listening to all voices, and then access to and equity in those vaccinations. That's how we get out of this pandemic. Several options for you in terms of vaccines. Hattiesburg Clinic opened up their vaccination portal again today, taking appointments for first doses. You can look at Iris. You can also call their hotline at 261-1620. And again, this is at Hattiesburg Clinic's 28th Avenue location. Second way, Walmart is beginning to do vaccinations as well. And both Walmarts in Hattiesburg, the one in Petal and the one in Laurel, you can go to walmart.com/COVID vaccine to book your appointment and check availability. But most importantly, I want to remind you of this vaccination weekend coming up Saturday and Sunday. At C.E. Roy Community Center, that's 300 East 5th Street, where we've been doing testing on Monday, Wednesdays, and Fridays since May. But Saturday and Sunday from 12 to 5, we're going to do a special vaccination weekend, brought to you by Forest General, Hattiesburg Clinic, and the City of Hattiesburg. No appointment is necessary. It'll be first come, first served. There'll be 252 vaccines on Saturday and 252 vaccines on Sunday. We do know that when you put these out on a no appointment necessary, come in and get your vaccine. Again, this only applies to those populations that have been called in, which are people over 65 and people between 16 and 64 who have underlying health conditions. We do know that when you put this call out, you're likely to get a big response. And we know that we've had several people from out of town and even out of state come into Mississippi to get their vaccine. So I want you to help us make sure that if there's someone in your circle of influence that doesn't have access to technology and has trouble booking appointments and can't get anyone to answer the phone, or whether that's church or neighborhood or just someone you know, help us get them to the front of the line. We know there's going to be demand for this, so we really need to get folks there on time, maybe even a little early, to try and make sure that we get our folks in Hattiesburg who need this vaccine, who are eligible, but who are having trouble getting in line, get them to the front of the line. On Saturday, when we announced this, we heard from one of our local physicians, and that was Dr. Joanna Stewart. Dr. Stewart is a Hattiesburg Clinic physician, internal medicine, but she's also a Hattiesburg native. And one thing she talked about were health disparities and how this pandemic has amplified those disparities, whether economically, socially, and particularly when it comes to health. And so we brought her in to have an interview on what should those populations, those underserved populations and demographics, know about this free vaccine weekend and why it's so important to get the COVID-19 shot. And so this is our conversation with Dr. Joanna Stewart. And we are glad today to have Dr. Joanna Stewart from Hattiesburg Clinic. Not only is she a physician here at the clinic in our city, but she is also a proud Hattiesburg High Tiger graduate. She went on to go to Xavier University in Louisiana, and then went to UMC for med school, and then completed her internal medicine residency at the University of Tennessee Health Science Center in Memphis, Tennessee. And she came back home in 2013. And we're so glad that we have one of our own who is now gone off, seen the world, gotten her training, gotten her education, and then come back to take care of her city. And so, Dr. Stewart, thank you so much for joining us today.
Well, thank you, Mayor Barker, for having me this morning.
We're going to talk a little bit about the vaccination weekend that's coming up at Hattiesburg Clinic this weekend. And I know that you've spoken a lot about health disparities. In fact, this past weekend when we were having a press conference to announce the vaccination weekend, you discussed health disparities and their relation to the susceptibility of COVID-19 in high-risk populations. We have many of those high-risk populations in our own community here in Hattiesburg. And can you briefly talk through that and how it relates to access to this vaccine?
Sure. So the COVID-19 pandemic has really highlighted just how much work still needs to be done to address health disparities. The African American, Hispanic, low-income communities are suffering the most right now. African Americans are nearly 1.4 times more likely to be infected with coronavirus. Latinos are about 1.7 times more likely to be infected. Both Blacks and Latinos are nearly 4 times more likely to be hospitalized with severe life-threatening coronavirus symptoms, and nearly 3 times more likely to die from coronavirus. But it's not that Blacks and Latinos are genetically more susceptible to the coronavirus, but we are more susceptible to the long-standing health inequities that prevent us from getting appropriate medical care to stay healthy. For example, people in disadvantaged and minority communities are more likely not to have a primary care doctor and less likely to get regular checkups because of social determinants of health, like lack of insurance, poor employment, lack of transportation, etc. And when some are finally able to overcome these barriers and make it to a doctor, they typically present at a more advanced stage. So you're likely to find a higher prevalence of uncontrolled diabetes, obesity, cardiovascular disease in these populations. And we all know that these chronic diseases are risk factors for getting really sick and possibly dying from coronavirus. And despite suffering morbidity and mortality at a disproportionate rate, COVID-19 vaccination rates are among the lowest in our underserved communities. In our state, for example, African Americans make up about 38% of the population, but have received only 19% of the COVID-19 vaccinations given so far. And when you compare that to white Mississippians, who make up about 58% of the state's population, but have received about 70% of the COVID-19 vaccinations, you see a stark disparity here. And vaccination is so critical, and we have to continue to work to try to get the shots into the arms of our most vulnerable populations.
Exactly right. And part of that goes back to, the reason that Hattiesburg Clinic and Forest General and the city of Hattiesburg are all partnering to put this vaccination weekend in East Hattiesburg. I know that early on, we wanted to make sure that there was a testing site available to those vulnerable communities so that we could quickly diagnose people. And so it took a while to get that service expanded to this vaccination. But now that we have it, can you talk through why it's so important, why this weekend is so important, particularly with those vulnerable populations when it comes to combating COVID-19 at this point in the pandemic?
Yeah, well, first I want to say that a walk-in, no appointment necessary COVID-19 vaccine clinic is a huge deal. particularly for our underserved communities, who might not have access to a telephone or internet to schedule an appointment online. I think about my grandmother, who, if she was living, she would have had trouble signing up for a COVID-19 vaccine by way of internet or smartphone because she didn't have internet at her house and she didn't have a smartphone. So vaccine events like this one at CROR that's bringing the vaccine into our community is eliminating an access barrier, which should help to lead to more equitable vaccine distribution. The second thing that I want to say about that is that vaccination really is the best weapon that we have right now, in addition to wearing a mask and social distancing, in terms of fighting this pandemic and returning at some point to some type of normalcy. I've seen so many individuals and families negatively affected by the coronavirus in my work as a hospital doctor. And these COVID-19 vaccines are effective in helping to prevent hospitalizations and possibly dying from coronavirus. So I encourage everyone who is eligible right now to get vaccinated because it might just save your life or the life of someone that you love.
That's right. And I know one thing outside of the barrier for access, there are some common hesitancies when it comes to getting the vaccine. Part of those allude to, the unknowns about how the vaccine came about. Part of those are about some dark chapters in our nation's history when it comes to African Americans and medical research. And so, what are some hesitancies that you see in regards to getting the vaccine, and what would you say to a resident who was on the fence?
Yeah, so vaccine hesitancy or reluctance is very strong across the board. Lots of people are concerned about potential side effects, vaccine safety, cost, and effectiveness. One study I read a couple of weeks ago actually said that 70% of the general population was planning on getting the COVID-19 vaccination. Sadly, this number is even lower in the African American community, where about 42% of African Americans were planning to get the COVID-19 vaccine. I would like to believe that this number might be a little bit higher now as more people know people who have successfully gotten vaccinated. In the Black community, there is also an understandable strong level of mistrust in the medical system because of past injustices and racism. Some of this is rooted in the past, like the Tuskegee syphilis experiment, but some of this mistrust is also more current and personal from recent events of discrimination and racism. Either way, the feelings are justified and I understand. I would tell a resident who was on the fence about getting the vaccine to trust the science and trust in God. Trust in the facts and in your faith. About 2 months ago, I was where you were, needing to make a decision about whether or not I would get vaccinated. And I did have some concerns initially myself. But once I looked at the facts, there's really no reason for those eligible not to get vaccinated right now. The vaccines are safe. They have been fairly and well studied. They're free, so there should be no cost, out-of-pocket cost to anyone, and they're very effective at preventing severe illness and death from COVID-19.
And I appreciate you saying those things, and I encourage everyone who's watching this today to one, understand that vaccines are in high demand, and anytime you put a free vaccination, especially one that's walk-in, no appointment necessary, you're going to have a lot of folks from out of town and a lot of folks from out of state that want to come in potentially and get this vaccine. I encourage anyone with family, anyone who knows someone in their church or their neighborhood, help get your family member, help get your loved one to the front of the line. It's important that you probably get there early on Saturday and Sunday because there's only 252 doses on Saturday and Sunday from noon to 5. They're going to be available. So I expect people to be lining up early, and I would encourage our folks who live in Hattiesburg to do just that. I would also say that for those of you who haven't been able to get a vaccine, reach out and say, hey, I'm struggling. Hey, I can't get this to work yet. I can't get on. I can't get an appointment because there are a lot of people, including our office, that will help do that. And I just want to thank Dr. Stewart for being here today. One, for not only being from Hattiesburg, but coming back to her town and serving her fellow community members. And so, Dr. Stewart, thank you for what you're doing in this pandemic, and thank you for being part of Hattiesburg and doing life with us. We thank Dr. Joanna Stewart for being with us today for that conversation. Want to tell you about one piece of city news for you. Paving crews continue today in Ward 3 along the 40th Avenue corridor, Bel Air Drive, Belmont Drive, Kensington Drive, where all that process for paving those began today. As long as the weather continues, hopefully holds up this evening and tomorrow, some more paving will happen as well. And finally, our act of courage. We know that a lot of arts programs, a lot of performances, and other things, other extracurriculars that students are involved in, were canceled during this pandemic. And so we want to send an act of courage out to Sacred Heart Center Stage Theater, who successfully put on a show this past weekend, 4 shows at the Hattiesburg Community Arts Center. They performed Clue, and they did so in a very safe manner with social distancing and with the actors, none of the actors getting infected. And so we appreciate the work that Abigail Lenz Allen did, as well as Olivia Drinkwater, to make this happen for their students and also our community. And so one thing that we all look forward to as we come out of this pandemic are seeing our students and seeing performances and events and concerts together again. And so kudos to them for putting on a successful and safe performance. As we continue in the week, remember to wash your hands, take care of yourself mentally and physically, wear a mask if you go out in public, do only what is essential, and remember, you're safer at home. Have a good evening.